And just a reminder, today is Wednesday. Wednesday is double feature day. So about an hour after this webinar ends, we will come back and talk about body dysmorphic disorder. Is there anyone that has already registered? I imagine so, because we're nearly full. Good news is we do have a couple spots, so I'll put in the chat the link to register for that. So again, today's Wednesday, double feature day. We'll be talking about body dysmorphic disorder about an hour after this webinar ends. So if you'd like to join us, we have a couple spots left. Go ahead and register for that. All right. Windsor, Ontario is here. Wisconsin, Nashville, Tennessee, Louisiana. South Africa is here. Pennsylvania, St. Louis, Virginia, California. UK, Virginia, Ithaca, New York, Philippines, Albania, Tennessee. All right, we got Mary's already signed up. Kylie commenting on the hair. I tried where you have like the stretchy headband and you wrap the wet hair. The front looks better than the back. So as long as someone looks at the back of my head. Minnesota, Ottawa, Pittsburgh, Northern Iowa is going to be attending both, Ontario, Pennsylvania, Queens, New York, New Jersey. For those of you that are just joining us, welcome. We'll get started in just another minute or so. Just a reminder, today is Wednesday. Wednesday is double feature day. We will be having another webinar that will start about an hour after this one ends. We'll be talking about body dysmorphic disorder. So if you haven't registered for that, there is still a few spots open. Hop on into the chat over there for you. Look for that link to register. I mean, you're already here, might as well, right? I'll take an hour break. I might eat some lunch, and then we'll be back to learn more. New Jersey's here, Pennsylvania, Maryland, Houston, Atlanta, Virginia, Portugal, Wisconsin. Looks like lots of people are already registered for our double feature. Iowa, Tennessee, Sarasota, Strathmore, Hamilton, New Jersey, the OC. Washington, D.C. is here, Arizona, Maine. Thinking about going to Maine this summer, never been. Get some lobster. Alabama is here. Florida is hot. You know, I was just looking. I looked at Tampa. I think it was 97. India. Connecticut. Lots of South Africa today. Adriana, heatless curls. Yes, they were heatless. The problem with heatless curls, at least my problem, has been I never know how it's going to turn out. I never know what I'm going to wake up to. Texas is here, Harlem, Mexico, Cleveland, Jamaica. Brigitte, I am going to go to Portland if I go. I believe there's a restaurant called DeMillo's, and they have the lazy lobster. I don't want a whole lobster where I have to do the work or see it, so I need it to already be taken out. So if I go, that is my plan. Oh, Bonnie, thank you for the compliments. Bahrain is here, St. Louis, and Illinois. All right. We all know how much I love chatting with you in the beginning, but of course, we're all here for a webinar, so let's get started. Today, we're going to talk about understanding eating disorders. This is brought to you by Mindspring Mental Health Alliance, with a special thanks to Polk County, Iowa, for partnering with us and sponsoring today's webinar. So like always, mics are muted, cameras are off, Q&A feature is on. So if you have questions, hop on into that Q&A, send them over to me, check questions as we go through each section. If you have a question that I can answer through a future slide, I'm going to hold off until we get there. I'm going to save a little time at the end for questions and answers. So we're going to end in about 55 minutes. So just keep answering questions as long as time allows. Now, we do have many participants, and so please don't be offended or take it personal if I don't get to your question. Oftentimes, we run out of time before I can get to all of them. But I do my best to get through as many as I possibly can, as quickly as I can. Now, we do offer closed captioning. So you can go to the bottom of your screen, look for that CC button, give it a click, that'll turn captions on, click it again, and it will turn them off. And then for anyone that is new, my name is Jamie. I am a licensed master social worker. When I'm not here doing these webinars with all of you, I'm a therapist. Prior to that, I worked in housing for those that were unhoused, and then extensively in the child welfare system, working with kids and teens that had experienced some abuse or neglect, many of them being part of the foster care and adoption system. Now let's go over our frequently asked questions. This is being recorded, and everyone who registered for today's webinar will receive an email tomorrow with a link to the recording in it. Also in that email will be all of the resources we talk about today. No slides will be sent out. And then everyone who has registered for today's webinar and joins this live session will receive an email from certificates@mindspringhealth.org soon after the webinar ends. Complete the webinar follow-up survey that's linked in that email to receive your certificate. Certificates are not available for anyone who's only watching the recorded version of the webinar later on. And CEUs are not provided for community education webinars. All right, what are we going to learn about today? So we're going to go over what an eating disorder is, the signs and preventative factors, the types of eating disorders, and some practical steps. So let's just hop right into it. What is an eating disorder? So eating disorders involve extreme disturbances in eating behaviors and can include things like following rigid diets, binging on food in secret, throwing up after meals, obsessively counting calories. People with eating disorders use food to deal with uncomfortable or really painful emotions. Restricting food is used to feel in control. Overeating temporarily soothes feelings like sadness, anger, or loneliness. Purging is used to combat feelings of helplessness and self-loathing. So, distorted, self-critical attitudes about weight, food, and body image are part of it. It's these negative thoughts and feelings that fuel the damaging behaviors. Over time, people with an eating disorder lose the ability to see themselves objectively, and obsessions over food and weight come to dominate everything else in their lives. The road to recovery begins by identifying the underlying issues that drive their eating disorder and finding healthier ways to cope with emotional pain. So, what are some myths? First myth is you have to be underweight to have an eating disorder. Fact is, people with eating disorders come in all shapes and sizes. Many individuals with eating disorders are of average weight or even overweight. Second myth is that only teenage girls and young women are affected by eating disorders. While eating disorders are most common in young women in their teens and early 20s, they are found in men and women of all ages, from children to older adults. People with eating disorders are vain is a myth. Fact is, it's not vanity that drives people with eating disorders to follow extreme diets and obsess over their bodies, but rather an attempt to deal with uncomfortable feelings. Eating disorders aren't really that dangerous. That's another myth. Fact is, eating disorders are serious conditions that cause both physical and emotional damage. All eating disorders can lead to irreversible and even life-threatening health problems, such as heart disease, bone loss, stunted growth, infertility, and kidney damage. So what are the statistics? Now, eating disorders affect at least 9% of people worldwide. Also, 9% of US residents, 28.8 million, will have an eating disorder during their lifetime. About 26% of people with an eating disorder attempt suicide. The economic cost of eating disorders is $64.7 billion every single year. Less than 6% of people with an eating disorder are medically diagnosed as underweight. And that goes along with that myth that you have to be underweight to have an eating disorder. Eating disorders are among the deadliest mental illnesses, second only to opioid overdose. And 10,200 deaths each year are the direct result of an eating disorder. So that's one death every 52 minutes. About the length of this webinar. And we do see a bit of a difference in men versus women. So anorexia is a much higher rate in women than men, 95% to 5%. Bulimia gets slightly closer, 80% to 20%. But interestingly, binge eating disorder is 50-50. So although American women struggle with eating disorders more frequently than men do, men also face eating disorders. Unfortunately, it's widely believed that men rarely develop eating disorders. This belief can lead to a later diagnosis from medical professionals and can increase the risk of death that's associated with these disorders among men. Research from the Department of Psychology at York University in the United Kingdom has found that women are more likely than men to experience brain activity relating to negative body perception. And then people with eating disorders are at an increased risk of developing or being diagnosed with another mental disorder. Depression tops that list at 70%. Now, further research suggests that eating disorders and anxiety disorders have more than a 60% rate in common. So in addition to people with eating disorders experiencing heightened anxiety around food and weight, studies show they also have an increased rates of social anxiety at 20%, OCD at 41%, panic disorders at 11%, and trauma or PTSD caused by that trauma at 13%. Plus, research clearly indicates that co-occurring depression or anxiety can act as a barrier to someone receiving the expected amount of benefit from eating disorder treatment. So we have to be treating both disorders, not just one. Now, what are some risk factors? Now, risk factors aren't the same as cause. These are contributing factors that increase our likelihood of developing an eating disorder. So things like mental health, right? The presence of these factors are going to predict higher risk, but it doesn't guarantee the development. And when it comes to mental health risk factors, this includes anxiety, depression, low self-esteem, experiencing trauma, such as childhood sexual abuse. Social stressors, such as peer pressure and bullying, may be involved. Risk factors related to eating behaviors and body image may also be tied to the development of an eating disorder. And these could include weight-related teasing and critical comments about weight, having a fixation with a thin body, early childhood feeding, eating or gastrointestinal problems, and body dissatisfaction. Twin study research, which can isolate the role of genetics, has confirmed that approximately 40 to 60% of the risk for anorexia nervosa, bulimia nervosa, and binge eating disorder arise from genetic influence. These findings do not imply that there's a single, eating disorder gene, or even that genes cause eating disorders. Some individuals may inherit traits such as anxiety, fear, perfectionism, or moodiness that have been associated with the development of an eating disorder. These aspects of temperament have also been linked to a number of other disorders. The exposure to media, peer, and parental messages all contribute to whether a person idealizes thinness and engages in social comparison. And these two factors, that idealization and the social comparison, may potentially lead to poor body image and various forms of disordered eating. Eating disorders are likely the result of a complicated interplay of these factors. Even when a precipitating factor, such as a traumatic event, can be identified, there's almost always a combination of other contributing factors. For example, a person who is maybe genetically susceptible to an eating disorder may be more sensitive to weight related teasing and have a heightened reaction to it. You know, for instance, initiating a diet that then snowballs into an eating disorder. Now, trauma is a big part of this. Eating disorders are not entirely about food, but rather a way to control a specific aspect of a person's life. And sometimes people feel out of control and powerless after experiencing a traumatic event. And as a result, they use restricting or binging behaviors to control that aspect of their life in order to hide unpleasant feelings. Studies have shown that people who have experienced trauma are more likely to engage in eating disorders than people who have not. And we want to make sure that we're leading by example when it comes to younger people. Unfortunately, adults can forget how their actions and words can impact the lives of children. And when it involves body image and eating behavior, this can be especially relevant. While many factors contribute to the appearance and development of an eating disorder, a parent's attitude regarding body image significantly influences how children view themselves. An analysis found that a parent's concern about weight are actually the third leading cause of body image problems in adolescents. In fact, casually discussing diet plans or describing a desire to lose weight when you are with teens or children can negatively influence a child's body image. All right, so next we'll talk about some more risk factors, signs, and prevention. Before we do that, let me just check some questions. Can children have eating disorders? And they can. Most often we're seeing it in late adolescence, early 20s, but it's possible for someone to have an eating disorder much younger or much older. Is body dysmorphic disorder an eating disorder? And it's not. And we're going to talk a lot about that in the next webinar, which is going to start about an hour after this one ends. We'll talk about body dysmorphic disorder. And really the differences between that and an eating disorder. Body dysmorphic disorder is kind of about a perceived flaw, where eating disorders are more about control and the food, but they both have that piece of where someone sees something in their body that they may really focus on. There's a specific weight that someone needs to be at to be able to say that they have an eating disorder. And no, oftentimes we see people with anorexia at a very, very low weight, but that's not always the case. But I think that's what we often see when we're looking at media, right? That they're very, very thin, but there's other people that are very thin for other reasons. Also, when it comes to things like binge eating disorder, someone may be overweight. So there really isn't a specific weight that someone has to be at to be diagnosed. Can we see eating disorders be intergenerational? So where we see it in multiple generations, and it absolutely is possible, yes. Part of that, if kind of like we were just talking about that importance of leading by example, if we grow up in a household with someone who has an eating disorder, especially a parent, and we watch them eat in that disordered way or exercise, it can be something that young people pick up on. Does starving yourself until you're weak or you're told to eat count as an eating disorder? It may not. It's really going to be about the symptoms that they're having. And so every mental disorder has diagnostic criteria that have to be met. There are people that starve themselves, in protest, or oftentimes as people get older, they don't eat as often. There's other physical illnesses that can cause someone not to want to eat. So it could be a variety of things leading to this. How is disordered eating different from an eating disorder? So, an eating disorder is a diagnosed mental disorder. It has to meet specific diagnostic criteria. Someone can have disordered eating, so eating in a disordered way that doesn't meet that diagnostic criteria. So, someone who wants to lose weight and is eating only 800 calories a day, right? A grown adult, and tracking everything they eat, um, but don't meet all the other criteria for something like anorexia. That could be considered a disordered way of eating, an unhealthy way of eating. Can intermittent fasting lead to an eating disorder? So, dieting in general can be a contributing factor to an eating disorder. Not everyone that does any kind of diet will develop an eating disorder. Intermittent fasting is going, for an extended period of time without eating, sometimes 8 hours, 16 hours. And it's sure, right? As someone gets more used to not eating that often, they may want to go further with it, but not everyone who does intermittent fasting has an eating disorder. Great questions. All right, so before I move on, you know what I'm going to do? I'm going to open up the chat for everyone. We went over some myths and facts. We went over statistics. We went over risk factors. Is there anything that we just talked about that surprised you? Hop in the chat, let me know. I think a big surprise, when I learned more about it, is that we aren't looking for someone who's necessarily underweight. That's what I grew up knowing eating disorders as, and really I only knew about anorexia. And so that was interesting, right? To learn it isn't what we see in magazines, TV, movies. Some people are surprised by the, men versus women, 50-50 binge eating. Yeah. It's important, that to know that children pick up those eating habits from watching their adults. And so it could be parents in the home, it could be grandparents. It's the adults that, that they're watching. Yeah, that's so important. And I think it's important really to know that it's not just the parents. Yeah, that's the biggest influence. But I mean, if kids had a teacher who constantly talked about how they viewed their body shape and weight, talked poorly about themselves, mentioned that they hadn't eaten or what, those things can be picked up from kids as well. Lots of surprises about body dysmorphic disorder. And so I guess the great thing is if you haven't already, you can sign up to go to that webinar that starts an hour after this one ends to learn more about body dysmorphic disorder. We'll make sure you have the link for that. All right. Thank you so much. So let's talk about risk factors, signs, and preventions. And we already talked a bit about risk factors, but these are other risk factors that can contribute. So biological, having that first degree relative, a parent or a sibling who has an eating disorder, have much higher risk of anorexia, bulimia, binge eating. And it's not clear which genes are involved or if there's a specific gene at all. But it does seem to be some kind of genetic issues that put people at a higher risk of developing an eating disorder. Being overweight as a child or teen can increase risk as well. There's psychological factors. Some people with anorexia may have obsessive compulsive personality traits that make it easier to stick to strict diets and forego food despite being hungry. They may have an extreme drive for perfectionism, which causes them to think they're never thin enough. And they may have high levels of anxiety and engage in restrictive eating to reduce it. Many people with an eating disorder feel negatively about themselves and their skills and accomplishments. We have environmental factors. Modern Western culture emphasizes thinness. Success and worth are often equated with being thin. Peer pressure may help fuel the desire to be thin, particularly among young girls. There's dieting and starvation. Dieting is a risk factor for developing an eating disorder. There is strong evidence that many of the symptoms of anorexia are actually symptoms of starvation. Starvation affects the brain and influences mood changes, rigidity in thinking, anxiety, and reduction in appetite. Starvation and weight loss may change the way the brain works in vulnerable individuals, which may perpetuate restrictive eating behaviors and make it difficult to return to normal eating habits. Now, many people with bulimia severely restrict calories between binge episodes, which may trigger an urge to again binge eat and then purge. Other triggers for binging can include stress, poor body self-image, food, and boredom. And many people with binge eating disorder have a history of dieting. Dieting or restrictive calories during the day may trigger an urge to binge eat at night, especially if you have symptoms of depression. And transitions can be a risk factor, whether it's new school, home, or job, a relationship breakup, or the death or illness of a loved one. Change can bring emotional stress and increase the risk of an eating disorder. So what are some signs? And first, we'll talk about signs based on emotional and behavioral. So behaviors and attitudes that indicate that weight loss, dieting, control of food are becoming primary concerns. Preoccupation with weight, food, calories, carbohydrates, fat grams. They see that they begin to limit food that they're willing to eat, progressively becoming more extreme. Could also include any new practices with food or fad diets, including cutting out entire food groups. No sugar, no carbs, no dairy, vegetarianism, veganism. Now, I do want to point out, someone who falls into that category, no sugar, no carbs, no dairy, being vegetarian or vegan, does not mean they have an eating disorder. But those can be some signs, right? When someone starts to cut whole food groups out, that is not the only sign, right? Just because someone decides to be vegan does not mean they have an eating disorder. Right, so there needs to be other signs along with it, right? There are people that, try the keto diet, no carbs, does not mean they have an eating disorder necessarily. There's people that can't eat dairy just because they're not eating it, right? Doesn't mean that they have an eating disorder. But we do want to look out, right? If we're seeing some of these other signs, looking out for people that are cutting out whole groups, really one after another. They may be pretending to eat, throwing away food, hiding food wrappers if they're eating excessively. They may be uncomfortable eating around other people, might be wearing baggy clothes to avoid questions about their weight. May have some food rituals, eats only a particular food or food group, like they only eat condiments. Excessive chewing, doesn't allow foods to touch. Withdrawal from usual friends and activities, so they're slowly isolating themselves. There's extreme concern with body size and shape. May include frequent checking in the mirror for the perceived flaws in appearance, complaints about appearance, fear about being or feeling fat. We'll see extreme highs and lows, intense sadness, anxiety, or irritability, often prone to anxiety or perfectionism, often feeling worthless. What are some physical signs? Fluctuations in weight. It could be both up and down. Stomach cramps, constipation, other gastrointestinal issues, pain, acid reflux, menstrual irregularities, so missing periods or only having a period because they're on hormonal contraceptives, which trigger the period. Abnormal laboratory findings, anemia, low thyroid and hormone levels, low potassium, low white and red blood cell counts, dizziness, especially upon standing, fainting, complains of being cold all the time. So we might see what looks kind of like a webbing or marbled pattern on the skin um, from being so cold, kind of red and purple marks or streaks, kind of looks like a net. Disrupted sleep patterns, trouble falling asleep, staying asleep, maybe they're sleeping too much. Dental problems such as enamel erosion, cavities, and tooth sensitivity, discoloration of the teeth from vomiting, cuts and calluses across the top of finger joints as a result of inducing vomiting, dry skin and hair and brittle nails. Sometimes we'll see like a soft hair on the arms and legs. Sometimes we could consider it like a peach fuzz, but a little thicker. And it's the body's way of trying to protect itself from losing so much heat associated with extreme thinness. A lack of proper nutrition can impact brain's ability to focus, feeling weak and difficulty performing tasks due to weak muscles. Immune system is impaired, resulting in frequent illnesses and potentially poor wound healing. Now, signs of binging specifically, so it's unexplained disappearance of large amounts of food in short periods of time, lots of empty food packages and wrappers that are often hidden or at the very bottom of the trash, hoarding and hiding stashes of high calorie foods such as junk food and sweets, secrecy and social isolation, might eat what like a typical meal around others, but then binge later on at night or in private where they won't be discovered. So, what are some preventative factors? Now, just as emotional factors can increase a person's susceptibility to an eating disorder, the opposite is true. Changing the environment can facilitate prevention and recovery. For example, growing up with warm, nurturing parents who could mitigate genes that predispose someone to anxiety. Other environmental factors, like developing an eating disorder, include family meals, emotional regulation skills, and mindfulness techniques. Those are protective factors from developing an eating disorder. Groups and individuals who question and challenge unrealistic ideals of beauty, including the glorification of thinness and the stigmatization of overweight people, are also helpful and protective. Many of these environmental changes, such as reducing the objectification of both men and women and increasing respect for people of all sizes and shapes, will benefit everyone. And these changes help create kinder and safer and more likely protective communities. So, what are the types of eating disorders? Before we hop in there, let me just check a couple questions. So, someone shared that they have a child with autism spectrum disorder that's eating very specific meals. And does that count as an eating disorder? Not necessarily. So when we're diagnosing an eating disorder, it has to meet certain criteria, diagnostic criteria, and one of them is that the symptoms aren't better explained by another disorder. And it is common for someone with autism spectrum disorder to be very specific in the foods that they eat due to sensory issues. So it may not mean that he has both autism and an eating disorder. If you're concerned about it though, because there's no way for me to diagnose it here, talk with the doctor and share your concerns. Can an eating disorder ever go away on its own? I don't like to say no, never, but It's very rare that mental disorders in general, including eating disorders, get better on their own, and most likely they get worse without treatment. Eating disorders are very dangerous, can cause someone to be very ill or pass away, and so we want to make sure that we're taking care of it quickly. Could the lower rates of men with eating disorders be related to a lack of them not seeking out help? Absolutely. Yes. Anytime we're talking about statistics, especially when we're comparing men and women, um, and hopefully someday they add more people than just those two classifications. But yes, the lack of diagnosis makes a difference, and so there is a lot of stigma towards mental disorders and eating disorders in general, but especially towards men for with an eating disorder. Right, so we have lots of kind of specific questions about the different eating disorders. So let's talk about that. So the DSM is the Diagnostic and Statistical Manual of Mental Disorders. It's created by the American Psychiatric Association. And in it, you're going to find all of the identified mental disorders, information about each of them, including that diagnostic criteria. It was originally published in 1952. Various editions have come out. We're now in the fifth edition, the text revision, which we saw come out in 2022. And so diagnoses are added, deleted, refined over time. And the DSM lists several eating disorder diagnoses, and we're going to focus on the four most common. So first, anorexia nervosa, coming from Greek, an meaning without, and orexis, appetite. So people with anorexia starve themselves out of an intense fear of becoming fat. And despite being underweight or even emaciated, they never believe that they're thin enough. In addition to restricting calories, people with anorexia may also control their weight with exercise and diet pills. A lot of this is about very difficult feelings and trying to cope with them, as well as feeling out of control and being able to control what they consume and their weight. Complications, so anemia. Blood doesn't have enough healthy red blood cells. Might be pale, fatigued, short of breath, lightheaded. Heart problems, such as abnormal heart rhythms or heart failure. Bone loss, increase of risk of fractures to the bone, loss of muscle, absence of a period, decreased testosterone, gastrointestinal problems like constipation, bloating, nausea, low blood potassium, sodium, and chloride, kidney problems, fluid retention causing swelling in the legs, ankles, or feet, shortness of breath, confusion, weakness, irregular heartbeat, chest pain, seizure, or coma in severe cases. Bulimia nervosa, from Greek, bulimia meaning ravenous hunger. So bulimia involves a destructive cycle of binging and purging. So overeating and then getting rid of the food that was eaten. So following an episode of out of control binging, eating, people with bulimia take drastic steps to purge themselves of the extra calories. In order to avoid weight gain, they may vomit, exercise to excess, fast, take laxatives. When it comes to the DSM, we need to see reoccurrent episodes of binge eating. And this is eating in a specific amount of time. So let's say within 2 hours, an amount of food that's definitely larger than most people would eat during a similar period of time and under similar circumstances. There's a sense of lack of control over what's being eaten and how much. And then there's reoccurrent inappropriate behavior to get rid of the calories to prevent weight gain. Self-induced vomiting, misuse of laxative, diuretics, other medications, fasting, excessive exercise. So what are the complications of bulimia? negative self-esteem, and problems with relationships, social functioning, dehydration, cause kidney failure, heart problems, severe tooth decay and gum disease from the vomiting, digestive problems, anxiety, depression, personality disorders, or bipolar disorder, misuse of alcohol and drugs, self-injury, suicidal thoughts, or suicide. Now, let's talk binge eating, which is different than bulimia. So people with binge eating disorder compulsively eat, overeat, and rapidly consume thousands of calories in a short period of time. It's different than bulimia nervosa because it doesn't have those compensatory actions, so those ways of trying to purge themselves of the extra calories. Now, with binge eating, despite feelings of guilt and shame over these secret binges, they feel unable to control their behavior or stop eating when they feel uncomfortably full. So again, they're eating in a specific amount of time, an amount of food that's definitely larger than most people would eat in a similar period. There's that sense of lack of control over what's being eaten or how much or how fast. Binge eating episodes are associated with things like rapidly eating, eating until uncomfortably full, eating large amounts of food when we're not even hungry, eating alone because of shame or embarrassment, feeling disgusted with oneself. And it occurs on average at least once a week for about 3 months for a diagnosis. Complications can be poor quality of life, problems functioning at work, personal life, social situations, social isolation, obesity, medical conditions that are related to obesity, joint problems, heart disease, type 2 diabetes, stomach issues, trouble sleeping due to breathing struggles. And then lastly, we'll talk about ARFID. This is avoidant restrictive food intake disorder. And so while picky eating and ARFID may have similar symptoms or behaviors, ARFID is differentiated by the level of physical and mental distress that eating causes, right? So it's not just about being picky, it's that there's physical and mental distress due to eating certain things. This is not about distress over body shape or size or fear of fatness. It's solely about the food itself. So ARFID involves kind of apparent lack of interest in eating food, avoidance based on the sensory characteristics of food. And again, this is going to be at a heightened level than what we would see in autism spectrum disorder, or concern about aversive consequences of eating, such as vomiting or choking. So either it's a lack of interest in food in general, avoiding the sensory characteristics of a food, or having fear of something bad happening like vomiting or choking. So what are some of the complications? Heart problems, kidney and liver failure, bone density loss, anemia, electrolyte imbalances, low blood sugar, constipation, bloating, and other gastrointestinal issues. A person with ARFID does not consume enough calories to grow and develop, and in adults to maintain the basic body function. In children, this results in a stalled weight gain and vertical growth. In adults, it might be a loss in weight, and for everybody for everyone of any age, most likely we're seeing nutritional deficiencies. All right. Next, we'll talk about treatment. So when do we want to see a doctor? Anyone who's noticing that they have a compulsion to eat large amounts of food or restricting their intake of food should talk with a doctor. Before your appointment, make a list of the symptoms you're experiencing and list out things that you think might not even be related, because it could be. You're going to give doctors personal information about like major stressors, recent life changes, all the medications you're on, and you can ask questions. You can ask a family member or a friend to come with you as well. Someone who accompanies you may remember something that you missed or forgot, or they can sit there and take notes so you remember everything that was said. And so treatment approaches for each person really depends on their symptoms or issues and strengths, as well as the severity of the disorder and which disorder they're diagnosed with. To be most effective, treatment for an eating disorder must address both the physical and psychological aspects of the problem. Goal is to treat any medical or nutritional needs, promote a healthy relationship with food, and teach constructive ways to cope with unpleasant emotions and life changes. So it is first priority to address and stabilize any serious health issues that have been caused by the eating disorder. Hospitalization or residential treatment may be necessary if your loved one is dangerously malnourished, suffering from medical complications, severely depressed or suicidal, or resistant to treatment. Outpatient treatment is an option when the patient's not in immediate medical danger. Nutritional counseling is recommended. Dietitians or nutritionists can help your loved one design balanced meal plans, set dietary goals, and reach or maintain a healthy weight. Counseling may also involve education about proper nutrition. And then therapy is going to play a crucial role in eating disorder treatment. Its goals are to identify the negative thoughts and feelings that are behind the disordered eating behaviors and to replace them with healthier and less distorted attitudes. Another important goal is to teach the person how to deal with difficult emotions, relationship problems, and stress in a productive rather than self destructive way. So, what to kind of expect when we're going through treatment? Now, although there may be exceptions, eating disorder treatment generally addresses the following factors in kind of this order. So, we're going to correct those life threatening medical and psychiatric symptoms. So, if they're malnourished, if they're suicidal, right, we're focusing on those things first. Then, we're going to work to interrupt eating disorder behaviors, the food restriction, the excessive exercise, binge eating, purging. Next, we're going to want to establish normalized eating and nutritional rehabilitation, challenge unhelpful and unhealthy eating disorders and eating disorder related thoughts and behaviors, address ongoing medical and mental health issues, and establish a plan to prevent relapse. Lastly, we're going to talk about some practical steps. Before we do that, let me just check a couple questions. So does someone have to be under treatment their entire life for them to be well? And not necessarily, right? Some people go through treatment and no longer have symptoms. For some people, they no longer have symptoms for a while, and then maybe a new stressor comes along. And then symptoms can come back. Can binge or can bulimia be binging and restricting? And so, in the diagnostic criteria, that purging, the getting rid of calories, is a requirement to meet the diagnosis. Here's the thing though, just because we don't meet the diagnostic criteria for a diagnosis doesn't mean that we don't have some troubling symptoms and shouldn't go to treatment. So we don't want to wait until we meet all the diagnostic criteria before we go get help. Can someone have both anorexia and bulimia? They can, but they have to be in separate episodes. So it can't be happening at the same time. We have to have separate episodes. So someone shared that they work with a child who lived in an environment without enough food. When this person takes the child out to go eat, they also want to bring food home and they hide it. Should I be concerned? Is the question. It's not so much about concern. This is incredibly normal. So when we're talking about children that have been in situations of abuse or neglect, when there hasn't been enough food, it's very common. And so when we're caring for a child in that situation, we want to make sure that they know that there's always food available. So for maybe someone who has a foster child in this situation, leaving food out on the counter. And so it doesn't mean that they have access to like junk food all the time, but it's like, here is the food that is allowed to be eaten at any time. You don't have to ask. So they know it's always available. Not having food consistently is incredibly traumatizing. So in that case, right, the bringing home food and hiding it really isn't going to be necessarily binge eating disorder. It could be due to the trauma and being afraid of not having enough food, but you may want to bring it up and have them talk with a professional. All right, so let's talk about those practical steps. So how do we talk to a loved one? We're going to pick a good time, right? So when everyone's calm, things are going well, there's no distractions, and we're going to explain why we're concerned. I have noticed and I'm concerned because we're not lecturing, we're not criticizing, we're not using judgment, we're not trying to put them in a space where they have to be defensive, but they may feel that way anyway, because they've probably hoped that no one was noticing. So I have noticed. And it can be helpful to not talk about the actual weight if possible. So if we can find something, I've noticed there's been a lack of eating, and I'm concerned that you may not be getting enough nutrition. Be prepared for them to deny or be resistant, and there's a good chance that's going to happen. They may become angry and defensive. Give them some time and some space. So you remain calm, respectful. Don't take it personally. And just let them know, well, when you are ready to talk about this, I'm here. Now, if they are admitting to it, ask if there's any reasons why they would want to change. They might want to feel better. They might want to please their family. They might want to be able to return to work or school. And what really matters is that they're willing to seek help, not why. And then just be patient and supportive. Don't give up just because they may shut down. We don't want to give them ultimatums, right? You better eat this or you're grounded, right? Especially when we're dealing with younger kids, it's hard to not want to force them and threaten them. Avoid commenting on appearance or weight. People with eating disorders are already really focused on that, other than ARFID. So even assurances that they're not fat can kind of play into the preoccupation with their thinness. So we just want to avoid it. We don't want to shame or blame. We're not using you statements. You just need to eat. You're hurting yourself for no reason. They would do better. They would be better, feel better, have other actions that were healthy if they could. We can use I statements instead. I find it hard to watch you wasting away. I'm scared when I hear you throwing up. And then you can give some simple solutions. And it's not helpful to say things like, all you have to do is accept yourself. It's complex, right? And there's not really a simple solution. If it were easy, they wouldn't be suffering so much. And so we can provide them support and care without telling them, oh, if you just eat, everything will be fine. In the home, we want to set some positive examples, right? Because we talked about the adults being such a big influence, but even if the person with it is an adult, right? Instead of dieting, talking about your body, we want to eat nutritious, balanced meals and be mindful of how we're speaking about ourselves, about them, about someone on TV. We're avoiding critical remarks. We can make mealtime fun. So eating together as a family, maybe cooking as a family. Meals are an opportunity to show a loved one that food is something to be enjoyed rather than feared. We can't force them to eat. This will just cause conflict. Bad feelings likely lead to more secrecy and lying. So we can require that they sit at the table with the family during meal times, but we can't force them to eat. Now it's going to be dependent on where they are in treatment as well. But we want to promote self-esteem in your loved one regarding things that aren't how they look: intellect, athleticism, social endeavors, creativity. And then importantly, don't blame yourself. Parents especially often feel they must take on the responsibility of the eating disorder, which is something they truly had no control over. Once you accept that the eating disorder is not anyone's fault, you can be freed to take action that is honest and not clouded by what you should or could have done. So you can be helpful by learning all about the eating disorders. Now, you don't have to be an expert, you don't have to know everything, but understanding it better helps you be a better support system. We're listening without judgment, so we're showing that we care, and we're not judging what they have to say. And we want to avoid the urge to advise or criticize. Be mindful of triggers. So we're avoiding discussions about food, weight, eating, or making negative statements about our own body. And then it's really important to take care of yourself. Don't become so preoccupied with your loved one's eating disorder that you neglect your own needs. Make sure you have your own support so you can provide it in return. Whether that support comes from a trusted friend, a support group, or your own therapist, it's important to have an outlet to talk about your feelings and emotions. It's also important to schedule time in your day for relaxation and doing things that you enjoy. So, recovering from an eating disorder takes time. There's no quick fixes, so it's important to have patience and compassion, provide hope and encouragement, and stay positive through struggles and setbacks. Now, here are some additional resources, including support groups. We'll make sure all this is in the email we send out tomorrow, and you'll find links in the chat. Crisis resources, different numbers you or someone you know who are in crisis can call to get information, support, and talk with someone. You'll have access to all this in the email and links in the chat. And here are upcoming webinars. Just a reminder, today is Wednesday, and Wednesday is double feature day. We'll be talking about understanding body dysmorphic disorder in just about an hour. If you haven't registered, we're going to put the link to register in the chat for you. And then the other webinar this week is Understanding Avoidant Restrictive Food Intake Disorder, ARFID. So when I was just talking about ARFID, if that was maybe the first time you'd ever heard of it or you don't know much about it, make sure you register and come tomorrow so we can talk more about that as well. So we'll put the link to register for these in that email we send out tomorrow as well as in the chat. So take a look at these upcoming webinars. And while you do that, I'm going to answer a few more questions. Someone is having constant mood swings and loss of appetite. Should that be a concern? Yes, it doesn't necessarily mean that there is an eating disorder, but if we're seeing a change in both mood and appetite, that can be an indicator that something, whether mental or physical, is going on. Now we're excited to be offering in-person support groups in Polk County, Iowa. Meeting information is on the screen now, and you can also find the information on our website, mindspringhealth.org. Support groups are free, registration isn't required, and everyone's welcome. You can email Alex at arohn@mindspringhealth.org. We also have a survey that we're going to put up in the chat for you. So whether you're a current participant or are interested in attending support groups in the future, we want to hear your opinions. You don't have to be local to Des Moines, Iowa to participate in the survey. And if you didn't need some additional resources, head on over to our website, mindspringhealth.org, or on social media. You can find us on Facebook, TikTok, and Instagram at MindspringInfo, or on LinkedIn at Mindspring Mental Health Alliance. Send us an email at info@mindspringhealth.org. Now, in case you missed it in the beginning, let's go over our frequently asked questions. This has been recorded, and everyone who registered for today's webinar will receive an email tomorrow with a link to the recording in it. Also in that email will be all the resources we talk about today. No slides will be sent out, and CEUs are not provided for community education webinars. What is provided are certificates of attendance once you've completed the post-webinar survey. My goal is for everyone to leave here feeling like they learned something, and the survey lets me know if we reach that goal. The organizations that support our webinars want to know how their donations are used and what communities participate. And this data is randomized and confidential. No one's demographic information is shared. It is anonymous. So everyone who registered for today's webinar and joined us during the live session will receive an email from certificates at mindspringhealth.org soon after the webinar ends. Complete the survey within 48 hours to receive your certificate. And even if you don't want that certificate, we'd love for you to complete the survey. Your participation helps us to continue to offer free webinars. Thanks so much for joining me. I'll be back in about an hour where we're going to talk about body dysmorphic disorder. There's still time to register. And if I don't see you later today, I'll see you tomorrow. Bye.